Good morning. I'd like to start off by thanking my family for their support in this little European adventure, even attending this conference. Particularly, I want to thank my beautiful wife, fellow naturopathic physician, Dr. Christina Romero-Bosch. I am continually left in awe by your strength and intelligence, your wit and humor, in the midst of the absurdities of life. You are woman personified, and I love you. Thank you to the President and Secretariat for your grand efforts with this excellent Congress and for allowing me to present. The title of this presentation is Naturopathic Solutions for the Global Health Impact of Lowering Testosterone and Sperm in Males in Industrialized Countries. I felt it vital to the discussion to write a paper on this topic complete with proper citing from the research literature on all of the points proposed in this presentation. You can find that as a free downloadable PDF file on my practice website at www.hormone-zone.com. I'd like you to come away with some key concepts from this presentation. Firstly, some of the actual evidence that across the globe both testosterone and sperm are lowering. We will explore the physiology of testosterone that's relevant to the specifics of what I am presenting, sort of setting the physiologic backdrop to establish why it is important to us that there is this global decline, and what the inevitable health consequences are, but even more important, the social consequences of this decline, whether as social constructs causing the decline and or the decline causing formation of social constructs. The causative factors are numerous, and finally naturopathic and medical interventions, and I have no disclosures for this presentation. So, is testosterone declining in men? We do know that testosterone tends to decline at the rate of about 1% annually after the age of 30 across Western industrialized countries. But is testosterone declining in men globally from a generational standpoint? And yes, we are seeing evidence towards this end. In Finland, evidence suggests that 25 to 29-year-olds have lower testosterone than 70 to 74-year-olds. In Denmark, we see the more biologically active free testosterone is lowering. But a large observational study done by Travison in the United States showed an actual 22% decline in testosterone levels in equivalent cohort males from 1989 to 2004. This is showing a generational decline in male testosterone. So, what about sperm decline? There's more research on this topic, but it's more controversial because there's research analysis that's actually refuting the idea. But for the most part, most experts believe and conclude that we are seeing a decline in sperm count and morphology. So just like testosterone levels, sperm count also has a normal course of decline in the aging male, about 2% annually. And we see multiple examples of studies concluding a decline in sperm counts and fertility rates in age-matched generational cohorts. Denmark is showing a decline, the UK, Italy, and a very high fertility rate is observed in India. Most of the research started after a landmark 1992 study by Carlson in the United States showing a 50% decline in sperm from 1938 to 1999. And it sparked controversy and debate until a very large recent study in 2013 in France demonstrated yet another decline from 1989 to 2005. Now, since I've given this presentation in London in July of 2017, it was only merely just 2, maybe 3 weeks later after we returned that there was another large study that came out of Jerusalem that used regression meta-analysis, a very advanced statistical method to observe and analyze the data about sperm and from 1970 to 2005. And this was in the UK, it was in the United States, New Zealand, and Australia. And they did find a very significant decline in both morphology, meaning the shape, as well as the overall sperm count. So that was just a very recent thing that came out that's just further letting us know that there is an issue here with lowering sperm count in men across the globe. But it is worth noting that we do have a Spanish study showing normal sperm count and quality along with a very low incidence for testicular cancer. Many of the men in my wife's family of Spanish heritage will be happy to hear that, I'm sure, and they'll be gloating about it. The effects of testosterone are widespread in the male, affecting all aspects of his being in this interconnected fashion. The physical effects bring on secondary sexual characteristics, particularly at puberty, but also continue to influence well into adulthood. Anabolic effects such as increased skeletal muscle growth and bone density, androgenic effects of testosterone lead to the development of male secondary sexual characteristics, maturing the penis, increasing facial and body hair, enhancing the larynx. Testosterone influences the maturation of sperm, and testosterone is extremely important in optimal cardiovascular functioning. Emotional aspects of testosterone include mood stability and quality of life. Mental aspects of testosterone are well known, including enhancement of cognition, spatial skills, and recall. Intriguingly, testosterone is not only produced in the testicles and the adrenals, but it's also produced in the brain through a steroidogenic acute regulatory protein. Indeed, the brain is both influenced by and in direct need of testosterone. Now, finally, testosterone has a massive impact on social and behavioral aspects of the male, with a tremendous amount of research in both human and mammals in the field of behavioral endocrinology. The eminent Stanford neurobiologist and science writer Robert Sapolsky, it's a great place to start in understanding the behavioral aspects of testosterone. Testosterone enhances libido, risk-taking behaviors, and overall concepts of self-confidence. Men tend to be more aggressive, but when studied more closely, we see that it is most often about assertiveness in situations of status and dominance versus just outright violence. It is also about rule enforcement. Men ensure social order through punishment when the rules are not followed. Indeed, the antiquated concept and simplistic view that testosterone creates aggression and violence in men just ipso facto is being regularly challenged. One important idea is that testosterone promotes pro-social behavior, leading towards a tendency of honesty. In a double-blind placebo-controlled study of 91 men administered physiologic exogenous testosterone or a placebo, then given the task to self-report in this simple task in which their financial payoff depended on a self-reported outcome of a die roll. The men could increase their payoff by lying without fear of being caught. Now, both groups lied, or at least embellished their results to achieve a higher payoff, but the men that received the testosterone administration substantially decreased their lying. The health consequences of lowering testosterone in sperm are vast. Physically, there are many, but the most well documented is lowered bone and muscle, and the increased risk of cardiovascular disease and diabetes. We also have the direct association of lower testosterone in sperm with the testicular dysgenesis syndrome, or TDS, which includes hypospadias, the abnormal placement of the urethra, cryptorchidism, the condition of a missing testicle, poor semen quality, and testicular cancer. Mentally, we see an increased risk of Alzheimer's disease, dementia, and even age-related cognitive decline. Emotionally and psychically, we see an increased risk of depression and anxiety. And finally, we have social and behavioral consequences of lowering testosterone. One of the key results of lower testosterone is decreased sperm count and quality that leads to infertility, affecting birth rates, and perhaps most intriguingly, testosterone levels are associated with a tendency towards social structures. Two recent studies found that men with higher testosterone levels tend towards a capitalist social structure and were more self-reliant. Men with lower testosterone levels tend towards a socialist government structure and believed in a collective effort. The most poignant thing they discovered, though, at least in my opinion, was that they had these beliefs despite economic status. In other words, financially poor men with higher testosterone still believed in self-reliance. Rich men, having benefited financially from a capitalistic system but had lower testosterone levels, still believed in group government oversight. So, what are some of the reasons we are seeing testosterone and sperm lowering? In utero toxicity, exposure by endocrine disruptor chemicals, EDCs, influences testosterone levels and sperm viability in the male fetus. But less commonly known is the influence of maternal testosterone levels on the testosterone levels of the male fetus. Women with higher testosterone levels during the middle of the second trimester of development influence the male fetus to express higher testosterone levels and sensitivity to testosterone through the androgen receptor. This is revealed in the 2D/4D ratio. In both men and women, the ratio of the length of the second digit in comparison to the fourth digit is predictive of testosterone levels and predictive of a multitude of other physical and psychological parameters. We can see that the hormonal status of the mother, particularly testosterone, has a lot to do with testosterone physiology in the male offspring. Other causative factors for lowering testosterone in sperm include comorbid disease associations, the classic triad of diabetes, cardiovascular disease, and obesity, are both causal and resultant of lower testosterone levels. We even see an associated risk of thyroid disease. Lifestyle and environmental factors are extremely important because we can change these things. Nutritionally, lack of protein and high-quality fats, including saturated fats, will lower testosterone levels. Recreational drug use, including marijuana, may lower testosterone and increase estrogens in men. Interestingly, alcohol, when consumed moderately, actually increases testosterone levels, but when excessive, it will lower testosterone. Alcohol also has an inhibitory effect to sperm count. Multiple prescription medications have been shown to lower testosterone. Also, a sedentary lifestyle decreases testosterone and sensitivity to testosterone through inadequate androgen receptor activity. And finally, again, endocrine disruptor chemicals are affecting testosterone in sperm. There's mounting evidence that EDCs are actually affecting genetic systems, demonstrating one generation getting weaker than the other. Men are having less sex, perhaps as both cause and result of lowering testosterone. A recent study published in the Archives of Sexual Behavior found that American adults had sex about 9 times fewer per year in the early 2010s compared to the late 1990s. They offer 2 possible reasons for the decline. 1, there's an increasing number of individuals without a steady or marital partner, and 2, a decline in sexual frequency among those partners. And ultimately, men need to be challenged. It is the act of placing men in an environment that challenges their abilities and their ability to take care of themselves helps to enhance their testosterone and their position within society. Testosterone rises when we ask it to. Give reason for it. Testosterone acts, as all hormones act, as a permissive effect. This means that hormones potentiate a given reaction and even a given behavior. There often needs to be another stimulus. So, it's never as simple as stating that a singular hormone affects a biological system in a singular fashion. So even though this entire presentation is a focus on testosterone and its causes and effects, we must understand that it operates within a context, holistically. Testosterone does not operate in a vacuum. Let's move to treatment options. If in fact we are seeing a decline in testosterone in sperm, and it has all of these related issues, then naturopathic doctors and integrative physicians are capable of helping. We will discuss hormone replacement therapy, lifestyle and environmental modifications, naturopathic tools, and social and behavioral choices. All of these can help increase and potentiate testosterone in sperm and treat the related conditions. Now, diet is one of the major contributors to testosterone levels and sperm health. In general, adequate calories are needed, but more specifically, higher amounts of protein and fats, including saturated fats, are actually needed to support optimal testosterone levels in sperm. The treatment prescription for increasing testosterone in men may be quite antithetical to the testosterone and sperm lowering trend of veganism, to consider the work of Weston A. Price, who revealed the eating habits of indigenous peoples all over the world, that their health and their fertility was maintained and flourished on a diet of high animal fat, moderate protein, and fermented vegetables and grains. This is known as an ancestral diet. Exercise, in general, increases testosterone and improves sperm parameters. However, high-intensity, short-duration bursting exercise, such as sprinting or heavy weightlifting, increases testosterone more than low-intensity, long-duration cardiovascular exercise, such as long-distance running. Light therapy is very interesting. The use of low-level laser at approximately 670 nanometers has been shown to increase both testosterone and sperm. In fact, testicular laser therapy has been studied for well over 100 years with consistent results. Simple sun exposure without burning is also helpful. A foundational mainstay of naturopathy is the therapeutic use of water. Evidence suggests that cold water therapy stimulates testosterone and sperm production. Limiting toxins such as exposure to plastics, eating organic to lower pesticide load, and using personal hygiene products that are toxin limited are all easy places to start for most men. There are many classical botanicals that are used for male enhancement. However, very few actually show testosterone-enhancing effects. Tribulus is often touted as a testosterone booster. There is some evidence for this, but most of the evidence seems to point to its action as an aphrodisiac or libido enhancer. Additionally, there is ample evidence that Tribulus increases sperm count and motility, and the dose is about 250 to 750 milligrams daily. Now, Uricomia longifolia is a different story. There's more evidence for this botanical at increasing total and free testosterone levels. Uricoma is an Indonesian root herb and has been classically used for centuries as a male enhancement tea. To achieve optimal clinical results, be sure to use an extract of at least 1 to 100, but preferably 1 to 200. Anything less simply does not have the same effects. Doses are variant. This herb can be very stimulating for some men, but doses up to 2,000 milligrams are safe and often required for full effect. Ejaculation frequency is one strategy, something known in traditional Chinese medicine, the practice of preserving the jing or kidney essence. One easy prescription is to encourage limiting ejaculation frequency based on the formula of age divided by 5. So for a 45-year-old man, he would only ejaculate every 9 days. One other interesting and anecdotally effective Taoist practice is using injaculation to enhance vitality. This is the process of pressing on the perineum at the Zhenmo point, otherwise known as conception vessel 1, right at the moment of orgasm and ejaculation, preserving the energy and nutrients of the semen as it is reabsorbed through the blood. It also intensifies orgasm and improves prostatic health. Look, men need to be challenged. Not only does this increase testosterone and its response, it provides a reasonable outlet for men and potentially translates into psychological benefit. Western culture perhaps is not providing enough of this true challenge, where there are clear winners and losers within competition. As an example, we know that testosterone levels respond to winning in a competitive situation, such as sports. This is called implicit power motivation. Even the perception of winning, the belief in yourself and your status, your self-worth, increases testosterone. And finally, male initiatory rights, something that is found in many indigenous cultures, channels maleness and provides a backdrop to increase testosterone in a healthy and productive way. In Western cultures, who is responsible for these initiations of young men? It is the testosterone male that is charged with this responsibility. If we now understand that the testosterone male is made by the testosterone woman in the womb, it should be understood that it is the testosterone male who helps to mold him. Finally, we come to testosterone replacement therapy. A bioidentical hormone implies a biochemical structure that is identical to the endogenous hormone. It is inherently possesses less side effects. There are multiple routes for bioidenticals, all within their own unique pharmacodynamics and clinical results. Oral routes, transdermal creams, gels, and even patches all tend to have varying absorption rates delivering variant hormone levels and certainly variant clinical results. This is not always the case, but generally it is what I see. The pharmacodynamics have been studied and they demonstrate this up and down, peak and trough result. In our practice, we have excellent results with both subcutaneous injections of testosterone and subcutaneous testosterone pellet implants. In respect to the subcutaneous injections, we use testosterone esters such as testosterone cypionate. We administer small doses more frequently, typically twice weekly, into the subcutaneous fat of the abdomen, with the fat acting as a depot and releasing the testosterone steadily, lending towards consistent blood levels, and enhanced clinical outcomes. Now, subcutaneous pellets have been used in Europe since 1937 and in the U.S. at the University of Georgia Medical School since 1939. I am proud to say that I worked and studied for years with a pioneer in this field, the late Dr. Gino Tutera. Hormone pellets are placed subcutaneously in a simple minor surgery procedure, and through a slow and steady dissolution rate, the hormone is delivered 24/7. When appropriate, this is one of the most effective ways to deliver hormone, keeping the levels consistent for up to 6 months. The other advantage of pellets is they are nothing but crystalline testosterone, and their chemical structure has not been altered in any way. In summary, we can now see the larger picture of optimal testosterone and the optimal testosterone male. We can specifically see what constitutes the testosterone male. He possesses optimal muscle and bone mass with a lowered risk for osteoporosis. His cardiovascular functioning is excellent, and his overall metabolism is maximized. He is sexually active, and his libido is intact. He is fertile. He is lean. His cells are highly responsive to testosterone. He's emotionally stable. He possesses a motivation and drive to succeed and provide. He cares. The testosterone male is created and maintained due to several things. He stimulates his endocrine system with lifting heavy things through strong physical hard work. He is active. He benefits from a limited toxin exposure in his environment. His alcohol intake is moderated and tempered. From a clinical standpoint, he is functional and optimal with testosterone levels above 600 nanograms per deciliter. He is sexually active, sexually conscious. He is in control of his sexual prowess. He eats as his ancestors ate. The focus is on high-quality, toxin-free animal protein and fats. He is the vegetarian who eats meat. His mother provides the safe and toxin-free environment for him, in utero. And yes, indeed, testosterone men are created by the testosterone woman. Finally, who is the testosterone male? The testosterone male is a fully integrated man, balanced physically, mentally, and emotionally. He is confident and calm, but he is of action and will assert his position. He is sexually conscious and seeks to establish a family. He is a risk taker. He, in fact, and despite any conventional misconceptions, is overall pro-social. He is self-reliant. Most of all, he is free. Ladies and gentlemen, colleagues, testosterone and sperm in men are following. This is a widespread global issue with widespread global effects on men physically, mentally, emotionally, and culturally. This presentation today is the clarion call of action for all men and the women who love them and need them. I believe that naturopathic doctors and other integrative and functional medicine practitioners play a pivotal role in helping men. It will require a comprehensive approach to increase the consciousness of the testosterone male and the very consciousness of the society in which he resides. On a personal note, and in closing, my father, James Albert Robinson, who would be in his 80s were he still with us, was an Englishman, through and through. A Londoner he was. He lived through the London bombings of World War II as a child. He was tough. He was proper. He taught me the same. I came here to London as a child a couple of times with my father. He was deeply proud of his heritage. Of what little I really knew of him, that was the one thing that I was the most sure about: his love of God and country. and it makes me tremendously proud to stand here on the old sod, as it were. Perhaps for him, perhaps me, perhaps for the idea that manhood in all its boldness is important and necessary. Looking out at all of you, those who are listening now, being here at this conference among friends, I am truly hopeful and filled with pride. With our combined efforts, perhaps now, the fully integrated male will rise to the call of our times. I will leave you all with this. The world needs fully integrated men. God save England. God save the Queen. God bless America. Thank you.